Now we have something that indeed turned out to be my worst nightmare, something that's highly transmissible in a period, if you just think about it, in a period of 4 months, it has devastated the world, and it isn't over yet.
Some pretty scary words there from Dr. Fauci, and as you heard that ominous warning, not over yet, not by a long shot. Now, despite the continuing spread of COVID-19, we have not heard from the White House task force in now a better part of a month. But the task force, we at least hear, is still working behind the scenes. And Dr. Fauci says the White House is focusing on the reopening of the country. The virus, it has now killed more than 112,000 Americans. 2 million have tested positive in 19 states. They're now seeing spikes in cases as well as hospitalizations. This map, it tells a story. Orange and red indicate a growing number of people infected. Blue showing the places where numbers are falling. As you can see, the West and South are trending in the wrong direction. States like Texas, Arizona, and Mississippi, just a few of the states now experiencing their highest numbers of hospitalizations yet. In Arizona, reporting that they're running low on ICU beds. I want to bring in my guest to discuss Dr. Cioe-Pena, an emergency room physician for Northwell Health System. He's also the systems director of global health. And doctor, it's always good talking to you. Thanks for the time. First, if you could clear up, there was some confusion from the WHO as to whether or not an asymptomatic person can transmit the virus. Which is it?
Yeah, so this is an area where there has been some confusion in the last couple of days, and I think it's unfortunate because the truth is that we don't know how much of an extent this plays, but we do know it happens and it is possible. And there's definitely documented evidence of people that are either pre-symptomatic or asymptomatic that are spreading this virus. So it's simply untrue to say to what extent that role plays in the overall viral transmission, but we do know it's possible and something that we need to defend against.
Obviously, everybody wants to get out, and people are. And as we saw, take New York State here, every place north of the city is in the phase 2 stage of reopening. But are you concerned that in the effort to reopen, some of the mitigation efforts that have been successful and have worked, from the social distancing to the masks, et cetera, by not adhering to it, we are accelerating when this second spike could happen?
Yeah, absolutely. It's definitely a concern. I do think that the phased reopening is a smart plan. We do need to reopen for economic reasons, for mental health reasons. Getting outside and doing as much activity as you can outside is very low risk. But when you're close to people, when you're within 6 feet of people, you've got to wear a mask. When you're indoors with people for a long time, you have to wear a mask. These are all things that are still important. Hand washing is still very important, as well as not touching your face.
You know, one of the things I saw, doctor, that jumped out at me was in Arizona, for example, hospitalizations, 50% of the people coming in their doors with COVID are people between 20 and 44. Are we starting to see trending here where we all thought it was overwhelmingly the elderly or people with pre-existing conditions that made them more susceptible to this? How concerning is that? I know it's a small sample, but still younger people being impacted by this, especially as we're trying to plan for the fall.
Yeah, I mean, I don't think we're out of the woods in any age group. I think we're still learning a lot about this virus. There's still much more to learn. There are things that we hadn't considered at first, which was the amount of clotting that this virus causes and the secondary injury to lungs and to other organs from these clotting events. So certainly, I think the message is still the same, that the most elderly amongst us are at the highest risk of dying from this disease, but nobody is really spared in terms of our risk factor. You can't say that a certain age group is just completely safe and without risk. And so that's an important message to maintain and continue. And we are seeing very severe disease in 20-year-olds, 30-year-olds, 40-year-olds.
A question I get a lot is, listen, everybody talks about this second spike, Rich. Is it if or when? And the only thing I know is, obviously, I just looked at history, and there always seems to be a second spike. People keep talking about the fall and the winter. Are we just being protective, planning for the second spike, or do you think there's an inevitability that this will come back again, most likely, 4 or 5 months from now?
I think it's going to come back. It probably hasn't left. And I think the more relaxed we are about social distancing, the bigger the spike is going to be. It's certainly, there's not enough immunity yet in our communities to protect us from this. So it's not going away. But could we potentially mitigate a spike so it looks more like a hill that's just kind of a longer slope? Absolutely. It does not have to be as long, as high a spike as it was the first time. We've learned a lot of important lessons on how to curb transmission. And if we get serious about them very early on and we have early detection and kind of an early warning system set up, then we may be able to mitigate the second spike so it doesn't follow the course of history and become the larger one.
One of the things is a lot of us, myself included, I'm sure you as well, we take the flu shot. And people point out, well, the flu shot's only really successful roughly half the time or something like that. Is that the same concern we have in a certain way with COVID, is that, this thing mutates, and because of that, and also because of the fact that, there's going to be, I would imagine, some inherent confusion in the fall or winter when people get the flu and it has some of the same commonalities as COVID does, which is which. What about the concern about the confluence from a timeline with the regular flu and COVID, and then also about the fact that this thing could be mutating?
Yeah, so I think obviously we're concerned about the coincidence of flu and COVID. We got lucky this time around, and flu numbers started to go down as soon as the COVID numbers started going up. Certainly, I think there's some misinformation about the flu shot. So the flu shot definitely, in some years only completely protects you from getting infected about 50% of the time. But even those that get infected have much milder courses, and there are very few deaths in immunized people due to flu. And so I do want to make sure that we don't lose the ball here. The chances of you needing to go on a ventilator or being killed by the flu is markedly reduced by the flu vaccine, more so than any other medicine or modality that we have to fight it. We expect very similar results with a COVID vaccine. And we also, I think, are relying on that to keep our ICUs not full with flu patients so that we can contain the COVID patients prior to the vaccine being readily available. So it's certainly a consideration. I think we do need to be really good about testing. We're getting better and better as a state and as a nation each day. And that will make this much easier to sort through, whether we're seeing a spike in flu or a spike in COVID, because in a sense, we're going to be much more ready on the second wave.
And that brings me to my last question, which is, are you more optimistic that whether it be treatment or a coming vaccine, when are you confident that you think you're going to be able to have these at your disposal here to help treat people or even get ahead of COVID going forward? And also, you talked about people, the big risk here is people relax and they don't use the protections. Do you have all the protections in the hospital that you need? I think we all assume you do, but do you have all the necessary levels of PPE and all the relevant equipment, et cetera, if this thing does come back?
It's a great question. And I feel very comfortable that as a health system, we have the PPE we need. We are exceeding the governor's mandate. The governor's mandating 90 days on hand at each of our hospitals. We feel more comfortable with 120 days on hand. So we're working to get to that supply level. And I do feel protected as a physician that works in the system and has seen a lot of COVID patients. I do think that we are better off and we are looking better in terms of as a nation at preparing for this. Certainly, there's not going to be as much of a learning curve in increasing social distancing as we see numbers go up. I think we'll be much quicker in our response because there's some cognitive barriers that I think were removed in the first spike that'll allow us to very quickly clamp down on it and hopefully make it a smaller epidemic in the second wave.
Well, Dr. Pena, I know how busy you are, so I always appreciate the time you make for us. Thank you so much. Best of luck and keep safe.
Thank you so much for having me.
Up next, millions of Americans literally struggling to feed themselves and their children. And right in the middle of all this, Republicans are actually looking to decrease instead of increase food stamps. After the break, a woman from a very significant food bank in the metropolitan D.C. market. She'll talk about just how bad things are getting out there.